Hi and welcome to Bradford Teaching Hospital's anterior cruciate ligament video series. This video is designed to help you prepare your knee ahead of your pending reconstructive surgery. The time leading up to surgery is very important and can help to improve your recovery afterwards. It is really important whilst you're waiting for your operation to do the right kind of activity. Research suggests that the stronger and more mobile the knee is before an ACL reconstruction, the better chance you have of returning to full function. The stronger your knee is before surgery, the stronger it will be afterwards. The anterior cruciate ligament, or ACL as we will refer to it in this video, is one of the main stabilisers of your knee, as it helps to stop the shin bone moving too far forwards in relation to the thigh bone. When this ligament is injured or ruptured, it can change the way your knee functions. Your knee may become unstable and affect your ability to participate in daily activities, such as your active hobbies. During your operation, the ACL is removed and a replacement or graft is put in its place. The graft is usually taken from your own body, normally from your hamstring tendons. Before your operation, you should aim to minimise any swelling in your knee, restore full range of movement and maximise your lower limb muscle strength. One of the key goals before an ACL reconstruction is to get your knee as straight as possible. This is known as knee extension. This can help with the function and movement in your knee after surgery. And we're now going to show you some examples of the exercises you should do at home in order to achieve the key goals before surgery. In the first exercise, you need to lie on a flat surface such as the floor or a bed and place a towel or cushion under your ankle so that your knee is off the ground. Gently tighten your thigh muscles and try to push the back of your knee down to the floor. Hold for 5 seconds, then relax, but still try to keep your knee as straight as possible. You need to repeat this 12 times and then rest for 1 minute. Repeat this 3 times every 2 hours. Once your knee is fully straight, you can reduce the frequency to twice a day. It's also really important to work on the bend in your knee, so we will show you an exercise for this. Again, you need to lie on your back, then bend and straighten the knee. You need to repeat this 20 times. Repeat this exercise 3 times a day. If you have access to an exercise bike, this can also help with the range of movement in your knee. Start with no resistance on the bike and aim to pedal for 5 minutes. Build up the time and resistance gradually. Using a bike will help maintain your cardiovascular fitness and, if possible, should be done 3 times a week. The quadriceps or thigh muscles are extremely important in helping the stability and function of your knee. Exercise 3 is squats, which can be used to increase your quadriceps strength before your operation. Stand with your feet approximately shoulder width apart and toes pointing forwards or slightly outward. Squat down by moving your hips backwards and bending your knees. Keep your weight distributed evenly. You should be able to feel the tension in your thighs and glutes. Push back up through the heels slowly, straightening your knees and hips until you are back in the standing position. Count to 3 as you go down into the squat position and again as you come up to standing. To begin, do 12 squats and repeat 3 times. Rest for 1 to 2 minutes between sets. Gradually increase to 20 repetitions per set. Avoid any deep squats with additional weight until your consultant or physiotherapist advises you that it's safe to do so. When you can comfortably perform 12 squats, you should aim to progress to single leg squats, focusing particularly on the control of your knee. Stand on a step and take your non-injured leg out in front. Lower the heel towards the floor by squatting down with your injured leg. Lower down for 3 seconds and rise back up for 3 seconds. It's important you keep your hip, knee and second toe aligned and pelvis level. Use a mirror if possible to ensure good control. It's also really important you develop the strength around your hip and pelvis and especially the glute muscles, as they play an important role in helping to control and support your knee. Exercise 4, the shoulder bridge, is a good way to strengthen your glutes. Lie on your back with both knees bent. Squeeze your glutes, roll your pelvis off the floor and straighten your hips. Hold this for 5 seconds and then slowly in a controlled manner return to the starting position. Start by doing this 12 times, building up to 20 when you feel you're able. Again, repeat this exercise 3 times. When you can perform 20 repetitions, progress onto one leg. Prior to surgery, you need to minimise any swelling in your knee. Using ice can help with this. Please remember though, ice can burn. The following advice will help reduce the chances of this happening. Protect the skin by applying a small amount of oil. Either baby or olive oil work really well. Always wrap the ice in a damp towel. Do not apply straight to the skin. Apply the ice for at least 10 minutes, but no more than 15 minutes. It's useful to do this straight after exercise. If any of the exercises shown in this video cause an increase in pain or swelling, please stop them and seek advice from a physiotherapist. Prior to your surgery, you should avoid any activities that include twisting and turning, such as football and netball, as this could put your knee at greater risk of giving way, which could cause further injury to your knee. Your consultant or physiotherapist will be able to advise you if you are unsure on which activities you should avoid. You should also avoid kneeling down, as this can also aggravate the joint. An ACL reconstruction is normally day surgery, and your rehabilitation will start whilst you are still on the ward. You will be given specific exercises to do, which will involve moving the knee and activating your quadriceps to make sure that your knee goes straight. Throughout your rehabilitation, you will be guided by your physiotherapists who have specialist knowledge of treating patients with ACL injuries. During these early stages, the exact nature of your rehabilitation can vary depending on the type of surgery you have had. You may receive instructions after you have had your operation, which are individual to you, and these instructions must always be followed. Some patients may have to wear a brace for several weeks. If at any times you have any queries, please discuss it with your surgeon or physiotherapist. After your surgery, it is likely that you will need to use crutches for up to a week. This will help with your mobility and any pain that you have. When you've been discharged after your surgery, your care will be transferred to the physiotherapy gym at St Luke's Hospital. Here, you will be assessed and given treatment by a physiotherapist. They will be able to guide you through the initial stages of your rehabilitation on a one-to-one basis. Several weeks later, depending on your progress, you will attend a class specifically designed for patients who have had ACL surgery. We will also give you access to online exercise regimes, and they will be specific to your stage of recovery. These will assist and complement your physiotherapy. Your physiotherapist will regularly assess you and guide you on when it is appropriate to progress your exercise routine. Here in Bradford, progression for each stage of your recovery is based not just on time, but by a series of strength tests that will dictate how much you will be able to do. You must only do the exercises given to you by your physiotherapist. Please remember, your rehabilitation process will be long and can last for up to a year after your surgery. If you are under 18, it will be a minimum of 12 months before you can return to sport. Physiotherapy is vitally important after your ACL reconstruction, and it's really crucial you engage with your physiotherapy sessions to optimise your recovery. Don't try to return to sport or activity before your consultant or physiotherapist advises you that it is safe to do so. If you return too soon, it can increase the risk of damaging your graft and the surgery failing. Here is a message from Mr. Guy, one of our orthopaedic knee surgeons, to discuss your upcoming surgery and the importance of your rehabilitation programme. Thank you.
Hi there, my name is Mr. Guy and I'm one of the sports knee surgeons here at Bradford Royal Infirmary, and I specialise in anterior cruciate ligament or ACL reconstruction. I'm here to reinforce what my physio colleagues have told you so far in the video. If you want to think of your knee like an engine, then I'm like a car mechanic who has put the missing part back in your knee. What's really important next is that we get the fuel, consistency and the muscle control right, which is how the physios come into play. Without good fuel or good muscle control and good balance, then it's very likely that you'll go back to playing sport and you may just re-injure yourself. So attendance in physiotherapy is obviously very important, not just to reduce your risk of re-injury in the knee that's been operated upon, but also to reduce your risk of re-injury on your good side too. Remember that recovery from an ACL is a marathon and not a sprint, and I wish you the best of luck.